The Child Neurology Foundation is a nonprofit organization whose mission is to support children with complex healthcare needs so that they can reach their fullest potential. We have created at the Child Neurology Foundation a network of over 87 advocacy organizations that have come together to provide social service and emotional support to families who have children with complex healthcare conditions. In doing that, our goal is to be able to find out where the gaps in care exist for our families and how we can fill those gaps for our families so that they can not only survive but thrive. What we heard from our families is that they were really struggling to find other families that were experiencing the same thing that they were, the challenges they were. They wanted to pick the brains of other families to see what their journey might look like. They also were struggling to put, to get basic needs met. So transportation, food, housing. Some of our families have children with complex healthcare needs and can no longer hold a job because they need to care for their child at home every day. And so this was providing a huge financial burden for them. It was providing just a lot of mental health concerns because they were constantly having to take care of their child every day. They love their child, but it's challenging to have someone else care for your child with complex healthcare needs. We also heard from our clinicians that they recognize this need for families to get connected to other families. They also recognized that families were really struggling with all these other social service needs, but they don't have the capacity to be able to fill these voids for these families. Their clinic visits are short and they don't have, the time or capacity to be able to meet all of these needs for families. And so we created at the Child Neurology Foundation a network of organizations in the rare disease space that help families and advocate on behalf of families, get families connected to each other to build community. Because we know that when our families have community, that they are less isolated. Their mental health improves. They don't feel so alone in this world. They pick the brains of the other families who are walking that similar journey. They get access to clinical trials that they never would have otherwise known about, better treatments, better doctors, and they just start to thrive again when they are connected. We are able to collect de-identified data on the back end about the services that our families are needing and able to get, and the services our families are needing and we can't find for them. We know that there are gaps that exist for our families who have children with neurologic conditions as far as the care that they're receiving. So we need unique things like when a child transitions from pediatric to adult care, where is the care for them during their adult life? There very little exists for these families. We also know that there are huge gaps when it comes to housing, huge gaps when it comes to respite care, and our families need to have, shelter. They need to have a break from their daily caregiving duties. They deal with a lot more stress than the average person, and we need to be able to provide some relief to them. And so what the Unitas platform has enabled us to be able to do is to find out where those gaps exist. And now, as our data continues to build, we have the evidence to show that these gaps exist and we can advocate on behalf of our families to get these programs put in place so our families aren't struggling day in and day out. Our goal is to really lift these families up and support them any way we can. We actually had recently a case where a child needed surgery for epilepsy. And unfortunately, their doctor did not reside in the state they live in. And so it was very expensive for them to get that surgery and really unaffordable, but it was needed. And so what we were able to do is get them connected to a law firm who was able to advocate on behalf of them to get the Medicaid coverage that they needed for that service outside of their state. That is incredibly important. When these surgeries happen, they are incredibly impactful for children and for families because they slow down the regression that our children experience every time they have a seizure. So this is just one example. We've had other examples where we've helped families find employment because they lost their job having to care for a child whose epilepsy was not under control. When a child can't go to school because their epilepsy isn't under control, the parent then has to take over. Employment is really difficult. We know that our families struggle with employment because they have so many more doctor's visits. They have so many more therapy appointments than the average person. And employers, unfortunately, don't understand that. So being able to connect them with jobs that do get it, maybe that are remote or flexible, is really, really important for our families. So those are just some of the examples of ways that we've helped to connect these families. We also have a social worker on staff who speaks English and Spanish. So that has broadened our ability to help an even wider array of people in our community. Our providers are our first touch a lot of times to our families, and our providers get to hear the challenges that our families face. Unfortunately, our providers are also tasked with, a lot of other things that they have to do day in and day out. They have so many different tasks that take up so much time, and they're being asked to do more and more and more, which limits their ability. And our providers are telling us that they are seeing that families are struggling to find social service supports. They're seeing that our families are struggling emotionally with their mental health, but they really just don't have the capacity to be able to find all these different resources for families, to connect them to other families who are walking a similar journey. And so they just need another hand. And so we can be that other hand for our clinicians so that they are able to focus on the medical aspects in a clinic appointment. We can then take over building that relationship with them and getting them the emotional support that they need, connect them to other families, and get them connected to other social services that they need. We can then check in on them 30, 60, 90 days out to make sure that they're still okay.